IVM.
Hey everybody, welcome to another week on the IVM Podcast Network. I'd like to thank our sponsors, Paytm Money Upfront. Guys, we're heading into week 2 of the lockdown, and I'm sure it's been challenging for all of you, just as it's been for us. We're doing our best to make sure that we maintain our schedules, but beg your indulgence if we slip. In the meantime, if you're looking for more stuff to listen to, might I suggest you go dive into the archives. We've got over 6,000 episodes of content we've created over the last 5 years, and I'm sure there's something in there that you'd love listening to. Anyway, stay safe, and let me get you started with your show.
Hi and welcome to Know Your Kanoon. This is Amber from Amber Rana Ventures, and welcome to this episode of Know Your Kanoon. So many of us would be venturing, and thinking that what kind of a public health safety system does India have, and what are the global public health safety systems that are in place around the globe, which are trying to help people deal with this pandemic. And is there really a body that really regulates and controls, and what are the ministries involved? So for all you individuals who are quarantined at home, this episode is dedicated specifically to help you go through and solve your inquisitiveness on what are the different bodies that are involved, how the Indian government is tackling the situation, what are the number of ministries. So let's have a look at that. So to answer your question then and there, firstly, and to inform all of you, there is something called as the NCDC, earlier known as the National Institute of Communicable Diseases. It comes under the Ministry of Health and Family Welfare. In 2009, the NICD, which is, as I spoke about, transformed into the National Center for Disease Control. The idea of this particular body was, to manage and control emerging and re-emerging diseases. NCDC now constitutes or is headed by a director, and it has the following departments. It has Center for AIDS and related diseases. It has Integrated Diseases Surveillance Project. It has Division of Epidemiology, where epidemiologists actually talk about, which epidemic is about to break. There is Division of Biochemistry and Biotechnology. There is Center for Medical Entomology and Vector Management. Then there is the Division of Zoonosis. There is Division of Microbiology. There is Division of Parasitic Diseases, and so forth, so on. So apart from just conducting training and research using a multidisciplinary integrated approach, the NCDC is also expected to provide expertise to the states and union territories on rapid health assessment and laboratory-based diagnostic services, surveillance of communicable disease, and outbreak of investigation. So basically, it's something like the CDC in the US, which is a very able body. It really regulates and sees what diseases are flowing in the country there. In US, it is used also for biological warfare to see if any country has launched a biological warfare there. In India, it's still in the nascent stage. We know there is no public health bill in India. It was tabled once in 2017, but it never saw the day of light in Lok Sabha. But so there are mechanisms in place. I'm going to talk about the ministries, how they work with NCDC, but let's just look at what NCDC further does. Apart from this, the NCDC is also expected, to notify public health emergencies of international concern to World Health Organizations. It is also required to respond to requests for verification of information of such events, support and field investigations for early diagnosis and technical guidance to states for timely and effective response. So just in case if, let's say the pandemic started in India, I would say if COVID-19 had come in India, it was job of NCDC to inform all the other WHO members. Let me remind you, India is a signatory of the World Health Organization. There are about 195 states, and India is also bound to abide by the international health regulations. So the international health regulations, though talk about laws that effectively come into picture for handling a pandemic, they also talk about the fundamental rights that should be upheld during such a situation. However, in India, it's a different situation. We do not have such central laws. There's only the Epidemic Disease Act, which is a colonial act. It does not hold the fundamental rights that much in the eyes of law, but we are somewhere coping with that, I think. And so I'm going to talk about those ministries and see where we fit in this whole gambit. How does the NCDC, notify in case of an outbreak to the WHO? There is a parameter given that for any report of disease that happens in a country, there are multiple parameters, but there are at least two that you must look at. One is the unusual or unexpected event. There should be an event that seriously impacts public health. There is an event with a significant risk of international spread, and there is an event with a significant risk of international spread requiring travel and trade restrictions. So thus what you saw currently happening in India was that all the airports, which are about 25 airports and 12 ports. Everybody on the airports was quarantined. People were stopped. There was a complete travel ban. There are public health officials who've been deployed. So all this derives power from the NCDC, who works under the Ministry of Health and Welfare. Furthermore, let's look at what's the role of NCDC at the state and district levels. So the effort of the government is also there that NCDC helps in establishing an early warning mechanism at the state and the district level. It is also working towards increasing the presence of laboratories in different states, establishing a network for surveillance and rapid confirmation of diagnosis, setting up of instituting appropriate and timely response for the prevention and control of outbreaks. So, what they're trying to say here basically through the legislation is that NCDC is also being percolated into the state public health official mandate as per the schedule, the 7th schedule of the Indian Constitution, to ensure that the state authorities have some kind of response unit in case of an epidemic or a pandemic to assist them with. So apart from these responsibilities, the NCDC has also the responsibility of identifying nodal officers at designated hospitals, at laboratories, state health directorates, district health authorities, local municipalities, cantonment boards, as well as the ministries of civil aviation, shipping, surface transport, agriculture, home affairs, tourism, railways. And these nodal officers are to be identified in the Customs, Immigration and Airport Authority of India, the Association of Shipping Agents, and Central Industrial Security Force. So basically what I can tell you right now is that what the NCDC is currently looking at is trying to actually provide all of this infrastructure to the respective government, which is the state and the center, in order to ensure that they have the requisite amount of officers, the workforce and the strength to seal if something like this does happen. So I have a data with me where this is, I think, 2013 or 14 data, which is available online as well. It states that there are currently 19 regional and 88 district laboratories. Additionally, 21 regional and 101 district laboratories, which have been established across India to deal with the pandemic. Also, these NCDC nodal officers, if we talk about their deployment at present, India has about 25 international airports, 12 seaports and ground entry with 3 major land borders, which is Bangladesh, China and Pakistan. Now, as per the NCDC data, which is old, which is 2015 and 16, 7 of the 25 international airports have functional airport health officers, which are the APHOs. 3 airports are in the pipeline for establishment of APHOs. And 15 airports, further who will be coming up will also have these APHOs. Similarly, there are 10 seaports, and which all of these seaports have the port health officers. And similarly, all border crossings, right? There are about 15 porous border crossings, and each of them have a functional health office starting from the Atari border. So I think overall, if we see, definitely there is a lot of responsibility the NCDC is holding in terms of securing us from a pandemic. These are government's efforts. They're amazing when we see how responsive they are. So it's just in the nascent stages, but I'm sure in future we'll have something better in terms of a body to deal with within endemic, an endemic or epidemic or a pandemic. Said all of this, what we really are actually relying upon is the National Disaster Management Act of 2005 and 15 being amended, and that being in place. It is our main source of body through which we are deriving the powers. So hopefully, again, I'll reiterate, hopefully again in future we'll have something in place. Another important highlight under the National Disaster Management Act, in case if you violate the quarantine rules or the quarantine provisions, you will be considered to be under obstruction of performance of duties by government officials and can be booked under the IPC. Now I'll conclude this session with mentioning the number of ministries that are involved and are covered in case a pandemic breaks out. So there are 3 levels of pandemics that are concerned in India for health purposes. One is the biological hazards, then there is chemical hazards, then there is radio and nuclear hazards, right? And out of this, there are 20 ministries. Some of the ministries are respectively as follows. The Ministry of Health and Family Welfare. The departments relevant to this are the Ayush Department, the AIDS Control, the Food Safety and Standards Authority of India, Health and Family Welfare. There is Ministry of Civil Aviation, there is Ministry of Shipping, there is Ministry of Railways, there is Ministry of Roads and Highways and Transport, Ministry of Environment and Forests, Ministry of Chemicals and Fertilizers, which includes pharmaceuticals and petrochemicals. There is Ministry of Science and Technology, there is Ministry of Home Affairs, there is Ministry of Mines. The Ministry of Home Affairs covers the following departments, which is the disaster management, the human rights, the judicial problem, the Northeast, the internal security and the police, which is the MHA. Apart from them, there is Ministry of Agriculture. So in case if a pandemic or endemic or a epidemic breaks out, the Animal Husbandry and Dairying Agriculture and Cooperation Department also comes into picture to restrain that, depending on what kind of a disease it is. The Ministry of Finance, you saw recently how the notifications came out for the direct and indirect taxations as well, trying to help citizens with their timelines. So all of them work collectively together in order to ensure that there is no outbreak. Then there is Ministry of Consumer Affairs, Food and Public Distribution. These are related to consumer affairs. Well, how this also works is the public distribution system, as we see, which is coming into place in India, is also controlled by this. So all of these ministries I'm talking about, they all work simultaneously, hand in hand, and they provide for literally about, let me tell you, 53 acts and 41 regulations that help us deal with a pandemic or an epidemic, but they are not centralized. They are individually vested in each of these bodies, who then have to sync and synchronize among themselves to ensure that there is a central procedure obtained. So what we are lacking actually is just that there is no centralized body right now. These responsibilities are divided and all of these departments need to be coordinated. So please keep listening and let me know in case if you have queries on this. You can write into me on contact@amranaventures.com.
Hi, my name is Anupam Gupta. I'm B50 on Twitter. I am the host of Paisa Paisa, a show that talks money. On my show, I speak to experts from every field of money and finance, from stock markets, equities, debt funds, credit cards, life insurance, every possible area of money and finance that you can think of. We even did an episode on cryptocurrency. I've got fantastic guests from mutual funds to personal finance experts everywhere. Robo-advisory, startups, just name it, we've got it. At Paisa Paisa, we help you make smart decisions about money. You work hard for money. Now make your money work hard for you. New episodes out every Monday, and you can listen to my show on the IVM Podcast app or any other podcasting app that you have.
Look! Up in the internet! It's a meme! No! It's a cat video! No! It's the Geek Fruit Podcast!
That's right, we interrupt this riveting broadcast to tell you about our show, the Geek Fruit Podcast, where Tejas, Dinkar and I, Jishnu, talk about everything in pop culture, including DC, Marvel, Star Wars, Netflix, and everything in between.
You know how your friends hate it when you ramble about some nerdy crap and you just want somebody to listen to you? Well, sorry, there's nothing we can do about that, but come listen to us ramble and it'll almost be like the real thing. Kind of.
Listen to new episodes of the Geek Fruit Podcast every Monday and the Geek Fruit Bulletin every Thursday on iTunes, Google Podcasts, the IVM app, or wherever you listen to podcasts. Happy listening, you nerds.